hi everyone, I am Dr. Anitha Gunalan. So in this session we'll be discussing about NEET 2023 question. So the first question here is, which of the statement is true about Trichomonas vaginalis? So we all know this Trichomonas vaginalis is a parasitic infection causing vulvovaginitis. So what options they have given is, it cannot be cultured, it can be cultured, the medium of choice is lash cysteine hydroxylate medium, or in pouch TV method can be used. Next, you will be able to appreciate twitching motility. Yes, correct. This is because of the trophozoite form. There are two types of trophozoite. One is the flagellated trophozoite. Another is the amoeboid trophozoite. This flagellated trophozoite is responsible for the jerky twitching motility. Next, cysts are seen on wet saline mount of vaginal secretion, which is a wrong option. There is only trophozoite stage. Only trophozoite stage is seen. No cystic stage is present. It is not a sexually transmitted infection. No, it is a sexually transmitted infection. Other things which you have to remember about Trichomonas vaginalis is, it will show strawberry appearance of vagina. Strawberry appearance of vagina is seen, and there will be profuse watery discharge, and the pH will be more than 5. And here, if at all you put 10% KOH, means the fishy odor will be increased, and this is called as whiff test. Whiff test. And the treatment will be metronidazole, and both the partners should be taken. Both the partners should be taken. So here they are asking which is a true statement. So twitching motility is seen on wet saline mount is the correct answer. Okay. Next question. A lady from West Rajasthan presented with an ulcer surrounded by an erythema on the right leg. Microscopy of the biopsy from the edge of the ulcer showed organism with dark staining nucleus and kinetoplast. What is the likely diagnosis? So the important hints in this question is, you are able to see kinetoplast. Patient is from Rajasthan. Okay. So organism which have kinetoplast are leishmania and trypanosoma. Okay, these are the both organisms which have kinetoplast. The history mentioned, they have mentioned that patient is having ulcer with erythema on the right leg. So this is pointing towards cutaneous lesion. Trypanosoma, though they have kinetoplast in microscopy, they are usually presenting as African sickness, or they present as Chagas disease, and they are usually seen in African and American countries. Okay, they are usually seen in African or American countries, whereas in the history they have mentioned that it is West Rajasthan. So this points towards leishmania infection, and here patient is having skin manifestation. So it is a cutaneous leishmaniasis caused by Leishmania tropica. So what they have said is they have seen organisms with dark stained nuclei and kinetoplast. This is nothing but the A mastigote form. This is nothing but the A mastigote form. It's nothing but the A mastigote form. And here the culture medium that is available is Novi McNeil Nicolis medium, triple N medium, or Schneider's Drosophila medium. So here you will be able to appreciate the pro-mastigate forms. Pro-mastigate forms. So the answer is Leishmania tropica. It is not Babesia because Babesia you will be having Maltese cross sign. It is not Trypanosoma because the patient is from West Rajasthan and patient is not having African sleeping sickness or Chagas disease. It is not histoplasma since patient is not having tiny, in histoplasma patient will be having tiny intranuclear yeast cells. Okay, so the answer is cutaneous leishmaniasis caused by Leishmania tropica. Next question. A child presented with fever and a rash to the OPD. His urine examination showed cells with owl eye appearance. What is the most likely diagnosis? Here they have given one clear-cut hint, that is owl's eye appearance. Owl's eye appearance is seen in Cytomegalovirus, and they will be having both intranuclear and intracytoplasmic inclusion bodies. So here the answer is Cytomegalovirus. Since this owl eye appearance is there, it is very much favoring to Cytomegalovirus infection. Another virus which has both intracytoplasmic and intranuclear inclusion bodies is measles. Here you will be having Wharton Finkeldy cells. Okay. So here the option is Cytomegalovirus. Next, infection with Clonactis sinensis associated with increased risk of. Okay. Before going to this question, the different liver flukes which we have to remember is fasciola, Clonorchis, and Opisthorchis. Among this, fasciola will be affecting the liver and the bile duct, whereas Clonorchis and Opisthorchis will be affecting the bile duct alone, and they will be causing obstruction of the bile duct, which will lead to dilatation of bile duct, which will later be followed by fibrosis, resulting in cholangiocarcinoma. So here the answer is cholangiocarcinoma. Next, a patient presented with complaints of persistent cough and weight loss. He had a history of contact with multiple sexual partners. He was diagnosed as HIV positive 6 months back and is poorly adherent to his medication. The fungal culture of sputum was negative. On Gomori methenamine silver staining, cells show darkly stained crescent-shaped cyst. What is the most likely causative agent? Okay. So here the points favoring diagnosis is HIV positive. So the patient is immunocompromised. Fungal culture is negative. Very important feature. Fungal culture is negative. And on Gomori methenamine staining, we are able to see crescent-shaped cells. Crescent-shaped cells. Okay. So, the thing which you have to remember is fungus which cannot be cultured are Rhinosporidium sibiri and Pneumocystis jirovecii. So these are the two organisms that cannot be cultured in fungi, and among this Pneumocystis will be typically having atypical pneumonia. Patient will be having no cough, but no sputum production will be there. Patient will not have non-productive cough. Patient will not have any sputum production. And it is more common in HIV positive patients. It is more common in HIV positive patients. And in Gomori methylamine silver staining, you will be able to appreciate black color crescent shaped cells. Black color crescent shaped cells. Crescent shaped cells are seen. This is also called as ping pong appearance. Ping pong appearance. Ping pong appearance, that is black cells in green background. And they cannot be cultured. So you have to read the question carefully. Persistent cough, HIV positive, cannot be, sputum culture is negative. So two fungi which are negative by fungal culture, Rhinosporidium and Pneumocystis jirovecii. Since they have given HIV positive patient crescent shaped cells, means it is pointing towards Pneumocystis jirovecii. Okay. Next, a sewage worker presented with abdominal pain, jaundice, conjunctival suffocation and blood in urine for the past 5 days. Which of the following is the investigation of choice? Okay, so with this history points towards a case of leptospirosis. Patient is having pain, jaundice, conjunctival suffocation and blood in urine. Leptospirosis can present as a mild icteric form, or patient can have severe manifestation. Hepatorenal hemorrhagic manifestation. Which is called as Weil's disease. This leptospirosis is caused by Leptospira interrogans, and this usually occurs following rainfall. 3 R's you have to remember: rainfall, rodent and rice paddy field. Usually farmers are more prone to get this infection following direct contact with the rat's urine, and this occurs more commonly in the rainy season. Here the culture medium of choice is Ellinghanson's McCullough Johnson Harris medium or Fletcher medium. These are the mediums of choice, and you have to inoculate the sample at 30 degrees Celsius and keep for 4 to 6 weeks. And microscopically you can able to appreciate tightly coiled spiral organism which can be seen only in dark field microscopy. Here for leptospirosis, the gold standard method to diagnose the condition is microscopic agglutination test. Other option mentioned here is Vidal test. Vidal test is usually used for diagnosis of typhoid. If at all in the question they have given patient is present with fever, maculopapular rash, patient is having rose spots, in such case Vidal test will be the answer. Wheel Felix reaction is usually done for diagnosis of scrub typhus. Similarly, in the question, if they are mentioned as fever with S-char, wheal Felic test will be the right answer. Paul Funnel test will be done for diagnosis of EBV, Epstein-Barr virus. Thank you.